What should women know about the pelvic floor and why is it important? I'm Dr. Nabila Noor, a board-certified and fellowship-trained urogynecologist, and let's talk about your pelvic health today. So the pelvic floor is essentially a combination of muscles, connective tissue, and ligaments, which essentially forms the base of our torso. So if you look at a pelvic model like this one right here, the bottom, so essentially all these parts right here is basically our pelvic floor muscles. So our pelvic floor muscle essentially forms the base of our torso right here, which is helping support all our pelvic organs. And pelvic organs can be things like the uterus, which is where the baby grows. It can be the bladder, which is where urine is collected. It can be the intestines or the bowel, which is where stool gets collected. So the pelvic floor is very important to make sure all these organs are correctly supported, as well as help these organs to function properly. What do I mean by that? So the pelvic floor is very important in bodily functions such as emptying your bladder or holding urine, emptying your bowels or holding your stool, as well as during intercourse and intimacy, during pregnancy and childbirth. During all these functions and all these times of your life, the pelvic floor needs to be able to tighten, to stretch, to relax accordingly so that all these functions can occur properly. Now, when the pelvic floor does not work appropriately to allow these bodily functions to happen, that is when women can end up with what we call pelvic floor dysfunction or pelvic floor disorders. And pelvic floor dysfunction or pelvic floor disorders can take various different forms. Things like bladder leak, pelvic organ prolapse, bowel issues, not being able to control stool, not being able to control gas, pain with sex. These are only some examples of the various different pelvic floor dysfunctions. When do women typically experience the most changes to their pelvic floor? So the two most common times when a woman experiences changes to their pelvic floor is during pregnancy and childbirth, and also during menopause and after. So during pregnancy, there are a lot of changes that's happening to the anatomy as well as the physiology of a woman's body. Physically, as the baby grows, it puts a lot of pressure on our pelvic floor, which essentially forms the base of our torso, which is the floor of our body, supporting all the pelvic organs, including the uterus and the growing baby. Also in pregnancy, a lot of women can experience constipation. So again, that constant pressure to have a bowel movement can also weaken the pelvic floor. Additionally, there are hormonal changes that's happening to the body, which can make the ligaments and the muscles weaker and more stretchy. During the process of labor and delivery, there's a lot of physical damage that can happen to the pelvic floor, especially if you're having normal vaginal delivery. Imagine a baby's head kind of pushing through the vaginal canal. There's a lot of stretching, and sometimes that stretching can cause lacerations where your vaginal muscles can tear. A lot of the times the nerves get damaged, and many times your surgeon or your OBGYN may actually do an artificial cut or a surgical incision called an episiotomy to enable the baby's head to come out easily. All these things can weaken your pelvic floor, and if not treated correctly, women may have long-standing problems afterwards. During menopause, our bodies go through a lot of changes, specifically the decrease in the hormone estrogen. In the absence of estrogen, women may develop things like vaginal atrophy, where they can have a lot of vaginal dryness, irritation. They may also develop symptoms such as urinary urgency, frequency. They can also have a lot of pain with intercourse. They may notice that they're getting a lot of urinary tract infections. All these things together are known as genitourinary syndrome of menopause. And again, this is another time in a woman's life when she notices worsening of her pelvic floor issues. How do you know if you have pelvic floor issues? What are some signs and symptoms? So let's talk about some of the common signs and symptoms that I see my patients complaining about. Now, the specific signs and symptoms of the pelvic floor dysfunction will depend on what exactly you're suffering with. For example, if you're somebody who has urinary incontinence, some symptoms may be urinary leakage with laughing, coughing, sneezing, exercise when you're jumping with your kids in the park or working out in the gym. Many women with urinary incontinence may also complain of things like not being able to make it to the bathroom, feeling like they're running to the bathroom all the time, having leakage if they don't get to the bathroom in time. In fact, some patients will tell me as soon as they get out of their car and put their key in the door, they can't hold that urine any longer. They have to rush to the bathroom. Similarly, when they hear running water or they hear the shower running, they can't control their urine and the urine just gushes out. So these are some symptoms that women who are suffering with urinary incontinence, which can be stress urinary incontinence and overactive bladder, may suffer with. Now, if you have pelvic organ prolapse, your symptoms may be completely different. These are women who complain of feeling a vaginal bulge, pressure, heaviness down there. Feels like something is coming out. And for some women, they may actually see a ball coming out through the vagina. So those are your pelvic organs that are being pushed through the vaginal wall. It could be the uterus, it could be the bladder, the rectum, or intestines. So if you're feeling heaviness and pressure and discomfort down there, maybe time to check out if you have pelvic organ prolapse. Another common thing is something called fecal incontinence, where patients are not able to control stool. These are patients who will tell you as soon as they feel like they have the urge to go to have bowel movement, they can't control it. They have to run to the bathroom, or by the time they get to the bathroom, they'll notice some staining in their underwear. Many women complain that they have no idea they soiled their underwear till they go to the bathroom and notice stool or staining in their underwear. You can only imagine how debilitating and frustrating and embarrassing these things can be. So if you or a loved one are suffering with these conditions, please don't suffer in silence. Many women suffer from having to run to the bathroom all the time, that frequent urge to urinate and not being able to control that urine and ending up with bladder leaks. But what causes this urgency or this loss of control? This is often known as overactive bladder symptoms, which is a combination of symptoms such as urinary urgency, where you feel that sudden urge to go and can't control it, urinary frequency, which is going to the bathroom more than normal times, the nighttime urination, which is often known as nocturia, as well as leakage or bladder leakage associated with any of these symptoms. So any combination of these symptoms or some of these symptoms is what we call overactive bladder. Now, there are many causes of overactive bladder. There could be neurological reasons as well as non-neurological reasons. Among the non-neurological reasons, a big risk factor is age. Although overactive bladder is not normal for aging, many elderly women will notice this urinary urgency frequency worsening with age. Also, as women go through menopause, there are hormonal changes that happens to our body, which can also contribute to these symptoms. Drinking a lot of fluids, especially fluids that can have bladder irritants, things like caffeine, alcohol, soda. For some people, it could be food items like spicy food, citrusy food, even dark chocolate can act as bladder irritants, making patients feel like they have to run to the bathroom all the time. Other things like a urinary tract infection or conditions such as bladder tumor or bladder stones or kidney stones can also cause symptoms of urinary urgency frequency. Being overweight, women with back issues, diabetes, these are some health conditions that can also make women feel like they have to run to the bathroom all the time. In terms of neurological issues, women who may have spinal cord injury or any kind of stroke or any kind of injury to their brain, conditions such as multiple sclerosis, these are some conditions that can also cause women to have a lot of urinary urgency frequency. Can you heal after a tear during childbirth? This is a question I get all the time. Let me tell you about my patient who came to visit me at 3 months postpartum. She had a beautiful, healthy baby. She saw her OBGYN at 6 weeks postpartum, and they told her that her second-degree vaginal laceration has healed completely. But even after that follow-up, my patient just did not feel like herself. She couldn't even sit properly because that area where she tore hurt. Having sex with her partner was painful and terrible. And to make matters worse, she was still continuing to have urinary leakage that she started to notice in the 3rd trimester, and was told that it will get better after she had her baby, except it wasn't getting better. My patient, while super happy and excited to have a baby in her arms, was also petrified and scared and completely demoralized that this is what she has to live with for the rest of her life. I did an exam. We talked about her delivery process, the different kinds of laceration that she had to endure, the scar tissue, and how healing and postpartum changes can take time to recover. Our body goes through so much when we are giving birth to our child. When we're giving birth, it's important to honor that and give ourselves grace and give our bodies the time it needs to heal. For my patients, we talked about some lifestyle changes. I started her on some pelvic floor physical therapy, and with some simple, minimally invasive techniques, she was able to get her previous life back and get back to doing all the activities she loved, being intimate with her husband, and enjoying their newborn baby together. So if this story sounds familiar to you, know that there is help. For more information and to learn more about your pelvic health, follow me on my YouTube channel, like this video, subscribe to my channel, and definitely share it with all those new moms who may be suffering in silence. Stay well, stay healthy, and don't forget to take care of your pelvic health.